Welcome to this lecture on government entities and organizations that influence healthcare and medical assisting. This presentation will introduce key government and professional organizations such as the CDC, OSHA, HHS, the Joint Commission, the American Medical Association, the American College of Physicians, and the American Hospital Association. Each of these plays a vital role in regulating healthcare standards, protecting public health, and shaping the work that medical assistants perform daily. By the end of this lecture, you should be able to identify the key government and professional organizations that impact healthcare. You will understand what each organization does, how it supports safety and quality in healthcare, and how these regulations affect medical assistants' daily responsibilities. The CDC is part of the Department of Health and Human Services and is responsible for protecting the public from health threats. It monitors and investigates disease outbreaks, provides infection control recommendations, and publishes vaccination schedules. Medical assistants rely on CDC guidelines to ensure proper hand hygiene, infection prevention, and patient education about vaccinations and public health initiatives. The Joint Commission is a nonprofit organization that evaluates healthcare facilities to ensure that they meet national standards for safety and quality. Accreditation by the Joint Commission means a facility has met rigorous standards of care. Medical assistants working in accredited organizations follow policies influenced by these standards, such as infection control and patient privacy practices. The American College of Physicians represents internal medicine doctors and provides continuing education, ethical guidance, and clinical recommendations. Its guidelines affect how healthcare teams diagnose and manage adult diseases. Medical assistants in internal medicine clinics may apply ACP recommendations when assisting providers or educating patients about chronic disease management. The American Hospital Association is a national organization that advocates for hospitals and health systems. It influences healthcare reform, promotes patient safety initiatives, and provides resources for healthcare administrators. Medical assistants benefit indirectly from the AHA's advocacy because it supports safer hospital environments and efficient care delivery systems. The Department of Health and Human Services oversees national efforts to enhance public health and welfare. It manages agencies such as the CDC, FDA, and Centers for Medicare and Medicaid Services. HHS policies affect healthcare delivery, insurance reimbursement, and patient safety programs that guide how medical assistants perform their role in clinical settings. OSHA is an agency within the Department of Labor. It protects workers by establishing and enforcing safety standards. In healthcare, OSHA regulations address bloodborne pathogen exposure, chemical hazards, and ergonomics. Medical assistants must follow OSHA standards by wearing proper protective equipment, using SHARPS containers, and maintaining a safe clinical environment. The AMA represents physicians nationwide and promotes excellence in medical practice. It publishes the current procedural terminology or CPT codes used for medical billing and insurance documentation. Medical assistants frequently use CPT codes when entering procedures or managing billing, making AMA guidelines critical to their administrative work. All of these organizations shape the work of medical assistants by establishing policies that guide patient safety, infection prevention, documentation, and professionalism. Whether following OSHA safety regulations, CDC infection control guidelines, or AMA coding standards, medical assistants play a vital role in maintaining compliance and high-quality patient care. In summary, government and professional organizations work together to establish a safe, ethical, and efficient healthcare system. From infection control to ethical practice and billing accuracy, these agencies influence every part of healthcare. Medical assistants must understand and adhere to these standards to ensure compliance, patient safety, and professional excellence.